As part of the Delivery System Reform Incentive Payment Program, or what's more commonly called DSRIP, Memorial Hermann is working with community agencies to improve access to health care, dental care, and mental health services in appropriate settings through 9 programs. These programs are transforming healthcare and lives while lowering the cost of care delivery. Here's a closer look at 4 of these vital programs.
Little Christopher was staying with his grandmother when his fever shot up.
I just have a fever.
I don't really know what to do in the moment. So I remember I have that number.
Anyone in Harris and surrounding counties can call the new community-branded helpline without charge.
Thank you for calling your nurse healthline. My name is Lori. I'm a registered nurse.
Registered nurses answer questions and help callers decide what to do when they have a health concern.
The objective of having the advice line is to keep people from going to the emergency room unnecessarily.
It's a great feeling to know that you've helped a parent or grandparent be able to tell them what to do at 2 in the morning.
I feel really comfortable because they told me what to do step by step. Next day they called me for the follow-up, so I really appreciate it.
Thousands of people with mental or behavioral issues turn up in area emergency centers every year looking for help. Many end up in the wrong place, like the Harris County Jail.
They're using the emergency room as the place to get their primary care for these disorders.
Memorial Hermann operates 2 mental health crisis clinics now, with a 3rd slated to open in October 2015. The clinics help walk-in patients as well as those brought in by crisis intervention teams.
The Mental Health Crisis Clinic will provide an opportunity for individuals with chronic mental illness to have access to a psychiatrist, a psychiatric nurse practitioner, and a licensed clinical social worker at the time of the crisis.
The clinic staff will then help that patient get connected to a permanent psychiatric home.
This in itself will benefit patients greatly because providers will be aware of other resources out there, be able to direct patients to get the care that they need.
It's tough to do well in school if you're feeling sick and your parents can't get you to the doctor.
Take some big breaths for me. Good.
Memorial Hermann school-based health centers bring free medical care to lower-income students so they don't miss out on their studies.
1 child, 15 absences in 1 year, 4 hospitalizations. Once we got him into our clinic, he's had 0.
In addition to taking care of standard shots, physicals, mental and dental health, the center's physician assistant can write prescriptions and make referrals.
I get a student that may come in a little timid at first, and then within a visit or 2, they're opening up to me, seeing me more as a friend, someone that's there to help them, not as a scary medical person.
The program provides medical and mental health services, as well as nutritional and dental services for more than 65,000 students in 70 schools in 5 area school districts.
I feel great to came here. The best thing about it is I don't have to leave my school.
And students who received care from licensed social workers showed improved grade point averages, reduced days absent from school, and reduced detention and suspension incidents.
There are partners in keeping our kids here, and if they're here, they're learning. So that's the goal.
I had a chaplain looking over me. I wasn't expected to last until morning.
Sanford Hughes has severe chronic spine disease, kyphoscoliosis, which landed him in the ICU a year ago.
When I first met Sanford, he was very, very sick, and his family was prepared to lose him.
After being referred to Memorial Hermann's new supportive medicine team, led by Dr. Sandra Gomez, he's been back home for a year and doing much better.
Blood pressure's not bad.
We have different types of patients in supportive medicine. Those we take care of in the hospital. We have patients in clinic. And then we have our home patients like Mr. Sanford.
If they have a supportive care doctor, they can get care prior to needing to come to the hospital. And the same with other chronic illnesses, including cancer, heart failure, obstructive pulmonary disease.
This new prescription for care is having great results.
By adding the support, the medications, the chaplain, the social worker, patients actually do better, and some of them actually live longer.
I am very, very, very pleased with the program. It saved my life.
These programs and hundreds like them across the state are having a tremendous impact on our communities. They are changing lives and improving access to care for thousands of uninsured and underinsured children and adults. These programs are providing cost-effective alternatives to emergency room care and filling the gaps in mental health services. We have come a long way, but there is still a long way to go. By continuing the 1115 waiver and funding for the Texas Healthcare Transformation and Quality Improvement Program, we can continue to offer and expand these vital DSRIP programs and transform healthcare and lives in the process.